official release of the 2025 Cancer in Iowa report from the Iowa Cancer Registry, based right here in the University of Iowa College of Public Health. How things are going to work today, I'm going to introduce the speakers. They're going to make their comments, and we'll open up the floor for Q&A, and then anybody who wants to do interviews, cutaways, outdoors, we can do that towards the end of the proceedings. So my name is Mitch Overton. I work in the communications office here at the College of Public Health. And today for speakers, starting here on my immediate left, we have Sarah Nash, Assistant Professor of Epidemiology at the UI College of Public Health and Director of Research Analytics and Dissemination for the Iowa Cancer Registry. Then we have Richard Deming, Medical Director of MercyOne Cancer Center and founder of Above and Beyond Cancer. Mark Burkard, who is Professor of Internal Medicine in the UI Carver College of Medicine and Director of the Holden Comprehensive Cancer Center. We have Katie McKenzie, who is a cancer survivor from Beaverdale, Iowa. Cathy Ketton, a cancer survivor from Waterloo, Iowa. And last but not least, we have Dr. Robert Kruse, who is the State Medical Director from the Iowa Department of Health and Human Services. So with that said, I'll turn it over to Dr. Nash to get started.
Thank you, Mitch, and thank you all for coming. So each year, the Iowa Cancer Registry focuses its Cancer in Iowa report on a different topic. This year, we have decided to focus on cancer survivorship. Iowa continues to have the second highest rate of cancers in the country and the fastest growing rate of new cancers. At the same time, improvements in detecting and treating cancer mean that our cancer mortality is declining. Combined, this results in an increasing number of cancer survivors, in our report defined as an individual from the time of diagnosis through the end of life. Many survivors need long-term support from their healthcare providers, their community, and their caregivers. So it's really important to understand the impact of a quickly growing number of cancer survivors. Before I talk about cancer survivorship specifically, I'd like to share some statistics that we present here in the report. We estimate that there will be 21,200 new cases diagnosed among Iowans this year because of cancer, which is an increase of 200 from last year. Breast, prostate, lung, and colorectal cancers continue to make up roughly half of all cancer cases in Iowa. Breast and prostate cancers, along with melanoma, oral cavity and pharynx, and liver cancers are increasing at faster rates in Iowa than the rest of the country, and lung cancer is declining more slowly in Iowa than the rest of the country. We estimate that there will be approximately 6,300 cancer deaths among Iowans in 2025, which is an increase of 200 from last year. Lung cancer continues to be the most common cause of cancer death in Iowa, accounting for about 1 out of every 4 cancer deaths. Colorectal cancer is the second most common cause of cancer death, and pancreatic cancer the third most common. These 3 cancers plus breast and prostate account for just over half of all cancer deaths in Iowa. So now moving specifically to cancer survivorship, we estimate that there are over 171,000 Iowans currently living with a previous diagnosis of cancer. Since a diagnosis of cancer sometime since 1973 when the registry began collecting data. This means that more than 1 in 20 Iowans will have had a cancer diagnosis at some point in their lives. And compared to the 8 other SEER registries, which have also been tracking their cancers for 50 years, Iowa has the second highest number of cancer survivors, behind only Connecticut. Those previously diagnosed with breast, prostate, and colorectal cancers account for half of all cancer survivors in Iowa. This is expected because breast and prostate cancers are the most common cancers in Iowa and have long survival time. So when the number of new cases is high and the number of deaths from a cancer is low, that means you'll have a higher number of survivors for that cancer. Given our high and increasing rate of new cancers coupled with a declining cancer mortality, we anticipate that the number of cancer survivors in Iowa will continue to grow substantially over time, meaning that survivorship care is going to continue to grow in importance to our population. Cancer survivors have unique needs that must be considered by healthcare providers, which may include screening for cancer recurrence and new cancers, addressing late effects and delayed symptoms of cancer treatment, and improving quality of life for cancer survivors through nutrition, physical activity and movement, tobacco use cessation, and other mental health and social support services. Survivor needs may change over time, depending on how long it's been since a person's cancer diagnosis, and may be different among different groups of survivors. For example, young cancer survivors may have unique needs, including developing a new identity after their cancer diagnosis, as well as managing long-term healthcare needs like fertility concerns and risk of second cancer. Survivorship resources are underdeveloped across the United States. While many healthcare and community partners are invested in supporting Iowa's cancer survivors, our main message here today is that there is an opportunity to increase this support. The Iowa Cancer Plan has a chapter focused on cancer survivorship, which contains 5 priorities, each of which includes goals and objectives that cancer control partners can use to guide activities towards improving quality of life for cancer survivors. And the Iowa Cancer Plan can serve as our blueprint to work together across healthcare, public health, and our communities to support Iowa's cancer survivors. So I'm really excited. Today we have a very distinguished panel of speakers who are going to share with us their experience across cancer survivorship. We'll start with Dr. Richard Deming, a radiation oncologist who provides cancer survivorship care within his community. Dr. Mark Burkard, who is going to share about survivorship research at the University of Iowa. Katie McKenzie and Cathy Ketton, who will share their cancer survivorship journeys. And then finally, Dr. Robert Kruse, who will speak on behalf of Iowa Health and Human Services about statewide efforts to respond to cancer survivors' needs. Over to you.
Thank you, Sarah. It's a great day to be alive. I am a cancer doctor. I'm not a cancer survivor. Kudos to Katie and Cathy. You're going to hear their stories. They're the reason we're here. Cancer survivorship is an important issue. As you've heard, there's a lot more of them, but they have some special needs. I grew up in the 1950s and 1960s. If in 1950 somebody identified themselves as a cancer survivor, they were probably talking about the fact that their spouse had died of cancer. There were so few people that were actually surviving cancer. My mom was diagnosed with stage 4 incurable lung cancer when I was a junior in high school. Didn't have the benefit of even the cancer treatments that we have now, let alone survivorship. The report shows that there's going to be about 171,000 cancer survivors in Iowa this year. More than 20,000 people are newly diagnosed every year with cancer. 2 out of 3 Iowa cancer survivors, 67%, were diagnosed within the last 5 years. So what you're seeing is that we're having a high incidence of cancer, but we're having much better treatment. Patients are surviving much longer, hence the increase in cancer survivors. This report shows that Iowa's rate of new cancers continues to increase about 0.7% each year, but at the same time, the proportion of patients living more than 5 years increases, and the mortality or death rate is decreasing. All of these combine to have 171,000 Iowans that are cancer survivors. Although there's been advancements in medical care, and that's drastically improved the cure rate, cancer survivors still face far worse physical and mental health related quality of life outcomes and a greater risk of a second cancer than adults who have never had cancer. Once a patient's been determined to be cancer-free, they often receive less personal attention from their cancer providers. That's unfortunate. Many cancer survivors experience ongoing physical, emotional, psychosocial, financial, spiritual, philosophical issues related to their cancer diagnosis and their cancer treatment. Survivorship care is an important part of the cancer journey, but one that is often unappreciated, or I should say underappreciated, by cancer centers and also by cancer survivors. A good health system treats cancer and kills cancer cells. A great health system takes care of patients and families who have experienced cancer. In addition to being able to reach a cancer-free status following cancer treatment, there are many patients now that are living with incurable cancer. That didn't used to be the case. Now with advancements in treatment, especially targeted therapy and immunotherapy, it's not unusual for a cancer survivor to be someone who is still actively receiving cancer, living for years and even decades. Today, I'd like to describe a multifaceted cancer survivorship program that we've developed at my cancer center, the MercyOne Cancer Center in Des Moines, and also through a not-for-profit called Above and Beyond Cancer. First of all, the survivorship clinic. I've been a cancer doctor I graduated from medical school in 1980. So for many years, I've been at MercyOne Cancer Center in Des Moines, Iowa for 35 years now. What I'm going to describe is not something that just happens overnight. It is understanding the complex nature of cancer survivorship. And I've been schooled by Katie and Cathy and thousands of others cancer survivors who have taught me what the needs are of cancer survivors. So what we've created is a cancer survivorship clinic that does several things. Number one, what's the ongoing surveillance needed for the cancer for which you were treated? Second, as I've already said, somebody who has survived one cancer is at higher risk for developing another cancer than is someone who's never had cancer. So what do we need to do to make sure that we're doing surveillance for other cancers that the patient may be at risk for? And then third, and probably most critically, the old-fashioned way was you're cancer-free. You should just be fortunate that you've lived in a time where you had cancer treatment that could get rid of your cancer. But as I've said, cancer survivors face many ongoing issues related to not only their cancer diagnosis, but their cancer treatment. The physical, psychosocial, emotional, spiritual, philosophical, all of those issues weigh in. Chemotherapy, surgery, radiation therapy has evolved to the point that, as I said, over 2/3 of patients are surviving for more than 5 years, but patients have ongoing issues. Some of those issues include fear of recurrence, body dysphoria, lymphedema, swallowing issues, weight loss, weight gain, loss of libido, sexual dysfunction, peripheral neuropathy, chemo brain, cognitive impairment, physical decondition, urinary and bowel incontinence, loss of income, interpersonal relationship issues. And then there's also the idea of what can we do to enhance the likelihood that someone who has survived one cancer won't develop another cancer. 45% of cancers in the United States are caused by modifiable risk factors, things that we have control over, such as tobacco, obesity, the type of food we eat, physical activity, alcohol consumption, whether or not you get an HPV vaccination, radon, environmental chemicals. All of these things contribute to the 45% of all cancers that are caused by modifiable risk factors. So part of the survivorship clinic is also helping individuals modify their lifestyle to have the best possible chance that they won't develop another cancer. A special part of the survivorship clinic is what we call Living with Cancer Clinic. As I mentioned, many individuals nowadays that are cancer survivors actually still have cancer and are under treatment with some of the more modern techniques. But I would say there are very special philosophical issues. How do you find joy in your life, living a life that you know is going to end from cancer? That's a particular interest of mine. So what we have done at our cancer center is not only do the surveillance for other cancers, but we have brought into the cancer center what we call integrative oncology. These are services that don't kill cancer cells, but enhance the quality of life. So we've put them into two general buckets. One bucket is touch therapy. So we brought into the cancer center things like acupuncture, massage therapy, chiropractic care, Reiki, reflexology, physical therapy, osteopathic manipulation, speech therapy, all sorts of rehabilitation services. But we've also brought into the cancer center mental health counseling for cancer patients, mental health counseling for the family members, the caregivers, sexual health counseling, menopause counseling, music therapy, art therapy, pet therapy, mindfulness-based stress reduction, nutritional counseling, palliative care. All of these are services that can help enhance the experience and provide great patient support as patients go through their cancer journey, and also help them thrive beyond cancer. I also want to touch on a separate program that we developed called Above and Beyond Cancer. Everything that I just described before this happens within our cancer center and is funded through philanthropy by the cancer center. Most of those services I mentioned are not reimbursed. Doing surgery, chemotherapy, and radiation gets a lot of reimbursement. doing all of the services that I described as integrated oncology are not generally reimbursed and are provided by philanthropy and through the generosity of people who feel that this is important. Above and Beyond Cancer is a public charity that happens out in the community. Above and Beyond Cancer's mission is to elevate the mind, body, and spirit of patients, survivors, and caregivers throughout the cancer journey. So we do about 30 different programs throughout central Iowa. These don't happen in the cancer center. These programs happen in the YMCAs, the healthy living centers, the senior centers, the city parks, state parks. And these things include physical activities such as meditation, yoga, Tai Chi, rowing, hiking, walking, outdoor cycling, indoor cycling, ballroom dancing, cooking classes, book club, but they're all done with the camaraderie and social support of doing these things with other cancer survivors. I want to call out Alice. She said I could call her out. Alice is a 12-year breast cancer survivor, a 2-year colon cancer survivor. She's been coming to my spin class for 12 years. So I teach a spin class at the Healthy Living Center in Clive, Iowa for cancer survivors. Alice is one of those front row people. So she's in the bike right in front of me. For 12 years, she's been coming. Last month after bike class, we celebrated her 90th birthday. And she still comes once a week, and she even stands when we stand. Once a year, Above and Beyond Cancer takes cancer survivors and caregivers on a mind, body, spirit journey of humanitarian outreach and physical challenge to somewhere in the world. We've done Mount Everest Base Camp, Mount Kilimanjaro, Machu Picchu, Mount Kailash in Tibet. And this year, we are taking a group of 30 cancer survivors and caregivers to climb in Torre del Paine National Park in Patagonia in southern Chile. And Dr. Mary Charlton, who's the head of the Iowa Cancer Registry, is going as a caregiver. So in conclusion, we are celebrating cancer survivorship, but we're also pointing out many of the unmet needs. And it's an important consideration. And with everyone's help here at the table, we can help elevate the lives of those touched by cancer.
Thanks, Dick. It's hard to follow such a great presentation of survivorship, but it's wonderful to be here this morning and to be here with you and talk about cancer survivorship. As a cancer physician like Dick, I've learned a lot from my patients and from survivors about what the experience is, because I'm not personally a survivor. I've taken care of many patients. What I've learned is it's frightening to hear the words, "you have cancer." And that's, puts the fear into a person of, am I going to make it? And today, more people are making it than ever before. As Dick said, we have more survivors in part because we are doing better. We are turning the corner on the war on cancer 50 years in. But that leaves us with a lot of survivors, and there are repercussions to being a survivor. We have an estimated 172,000 survivors in Iowa, or 45.4%. And these survivors have the after effects of treatment, but they also have elevated risks of new cancer, some of which are things we can work on, like obesity, smoking, and alcohol, and some things that are beyond their control, like age and genetics. And so we have to work with our survivors to do better. But I want to talk about this in the context of a personal story. About 15 years ago, a close family member of mine was diagnosed with tongue cancer. And he had young children and realized, he might not see his children grow up. And so he went to the doctors and did everything that they told him he needed to do to get rid of this cancer. That was his mission and focus during that time. And so he had surgery, had chemotherapy, had radiation, and he lived. He survived the cancer, but it changed his life. It changed his life in a very difficult way. He could not make saliva. He could not have dinner with family. There were things he couldn't eat. There was damage to his jaw from the radiation, and it required reconstruction. and life was never the same. So he's seen his children grow, but it completely changed his life. And every survivor has a different story, but that's an example of how just saying we won, we beat cancer isn't good enough, and how we have to think about doing more. So what can we do to help cancer survivors? Well, the first thing we talked about is addressing cancer risks. The things we can do are understand what is the cancer risk of the person who survived cancer. Is it a gene? Is there things we can do to prevent a new cancer based on that gene, such as risk-reducing oophorectomy, which is something we do in many breast cancer survivors who have a gene that would also predispose them to ovarian cancer. But also it's an opportunity to reassess habits and causes of cancer and to educate. And so we need to work hard with our survivors on exercise, smoking, alcohol, healthy eating habits. And one way we're doing that at the Holden Cancer Center, we're very blessed to have a researcher named Jess Gorslitz, who is developing a whole program to do exercise training in cancer survivors. And she's doing this not only here in person, she's working on ways to deliver this to the rural setting. And that's a wonderful opportunity to intervene. As you know, it's easy to say go exercise more, but it's harder to do it. And so getting the right program that provides the training, the incentive, and the opportunities for everyone is going to be key for that success. As another example of research that I'm very excited about was an experience I had from a patient. So I had a patient show up to my clinic a few years ago who said she was diagnosed with breast cancer in 1978 and it recurred as metastatic to the bone in 1982. And she had young children in her 40s and thought that was going to be the end. That's what her doctors told her, but she lived. And so we looked at the statistics. This was hard to parse out at SEER Medicare because they didn't parse out the statistics for metastatic cancer at the time. But looking through it with some collaborators, it looked like if you had metastatic breast cancer, about 4% of people lived 10 years, 1% lived about 20 years. And so she was down in the 0.2% of people who had lived by now over 40 years with metastatic cancer. So how is this possible? It's possible because every cancer and every person is different and has different survivorship needs and trajectories. We as physicians and researchers don't understand it all. And so it was an opportunity to identify long-term metastatic survivors like her to identify the things that could contribute to that survivorship or surviving well. And so we collaborated with the Susan Love Foundation, which became the Army of Women, which became the Army Research Army because it included men, and found survivors all over the US and all over the world like her to learn more. And so that's another example of an ongoing survivor research project. But cancer survivorship is a big challenge. You know, imagine 172,000 survivors in Iowa. We're struggling to care for the people with active cancer. How do we address the needs of the 172,000 survivors now? And given that some are rural, some are urban, some have different types of cancer and have different needs. The tongue cancer and breast cancer survivors are very different. So we have to prioritize what is the most important opportunity, what are the ways we can engage local providers, pharmacists, and others to collaborate on delivering that care. This is a challenge we're looking to reinvigorate here at the Holden Comprehensive Cancer Center through research. And you know, it's great to be here today to talk about survivorship as we move into the next stage of how we accomplish that. So thank you.
Thank you. Hi, my name's Katie, and I am here as a survivor. I have multiple myeloma, which is a blood cancer, and was diagnosed with that in August of 2019. I had a stem cell transplant in January of 2020. Was at Nebraska Med for about 6 weeks. So, you know, you time a stem cell transplant in the middle of January, I was released about 2 weeks before the world shut down with no immune system. So that was pretty tricky. It's a pesky little cancer that has no cure. But I've got, several cards in my hand of treatment options, which is great. I've relapsed once since my stem cell transplant and have been on this current treatment plan now for 2 years. So we want to hang out there for a while, and we want that research to continue. So I'm immensely grateful for the survivorship program opportunities that I've been able to participate in the metro. I live in Des Moines, through Above and Beyond Cancer, through the Richard Deming Cancer Center, through John Stoddard and Nebraska Med in Omaha, which is where as I mentioned, I had my stem cell transplant. I've done a couple of or participated in some online opportunities with them. So in October of 2020, things really changed for me. My employment changed. I thought I could go back to work like I had. It wasn't working, and just had some needs and sought out help from a social worker to address some of the financial concerns that I was having. So that was my first experience with a survivorship opportunity. Very helpful, and very shortly after that, I dropped into the hike and yoga group that meets every Tuesday morning through Above and Beyond Cancer at a park in Des Moines. And, it was completely isolated because of COVID, and this outdoor hike really saved or was life-saving for me. I was truly alone, and I was able to join a group. And so that was my first program with Above and Beyond Cancer. I have participated in many of the activities and programs over the last 5 years. Dr. Deming listed lots of those. I've had the good fortune of being able to do those. I've got, I've done group exercise, ballroom dancing, urban pole walking, Reiki and sound healing, indoor rowing, touch therapy, online and in-person cancer groups, the bike club, the cooking classes, and I've also had the good fortune to go on 2 transformational journeys. Here in the United States, I went to Utah in 2021, and just this past fall, joined a group. We were in Maine and New Hampshire hiking on the Appalachian Trail, which truly, the word transformational, it is, just the constant reminder that despite our situation, we can continue to do hard things. And when it was really tough, I'm like, I've done a stem cell transplant. I can do this, and having that group connection to help all of us, make it to the end. So, and even my daughter, caregivers can, and family members can participate in these activities. She has joined me in a number of those programs herself. So grateful for that. All of the programs have been helpful in reining in the stress and fear of relapse and help with that liberating me from cancer anxiety. There have been lots of times where cancer has been, in the front seat or in the driver's seat. When you have an incurable cancer and you're always on treatment, it's, that seems reasonable, but I didn't want it to be that way. So through these groups, through the opportunities, learning new strategies to kick that cancer to the backseat. It's always going to be hanging out, but it's not going to be driving. I've been able to develop the skills to live a more mindful life. Pre-cancer, I was spinning all the plates. I was working, raising kids, volunteering, having wonderful experiences. I had to learn how to rein all that in as well and truly live here in the moment. The programming, the exercise, just being with other folks in similar situations, help manage the side effects of weekly treatment. And quite frankly, the programs just plain feel good. They're just great. They it's a great day to be alive. Absolutely. And the other aspect of survivorship programs is the community that is developed. Survivorship has shown me the immeasurable values of community. The bonds I've formed with fellow survivors have created a compassionate space where we can share our stories, our challenges, and celebrate our victories. When you're with other cancer survivors, you can say a little and get a lot of understanding. Like I can say, I've got, scans coming up and everyone understands what that means. With others who haven't had that experience, and I used to be a cancer mogul myself, prior to diagnosis, you don't know. You don't know what you don't know. But when you're in that compassionate group of individuals, you get that understanding that you need. And family and friends round out what I like to call the bench strength. You've got to live a life where you build a bench strength. And I'm very lucky to have both in family and friends that help support me in still living a good life while undergoing cancer treatment. And I've said this before, but chemo keeps me alive, but survivorship programs keep me living. And I wish that for everybody who is touched by cancer. As I mentioned earlier, I sought out survivorship programs. They were not mentioned in my office visits, and I think it's important to, continue to have these conversations early in the treatment process, not at the end. There's this, sprint of treatment, and then there's the marathon. And I think the conversations around survivorship opportunities need to happen early in treatment and often repeated in the office, because you never know when that patient or that individual, like Cathy and me, will hear it at the point where we need to hear it, and then being open to participating in those programs. When they're ready. Yeah, even follow-up opportunities for participants to encourage their participation. So I hope all Iowans will have the survivorship opportunities that I've had. Thank you.
My name is Cathy Ketton. I'm from Waterloo, Iowa, and it is a great day to be alive. And I'm kind of jealous because I have not participated in one of your programs, Dr. Deming. So I need to come
change that.
I know. Come on.
Again, my name is Cathy Ketton. Cancer has deeply affected my family. I was my mother's caregiver when she was diagnosed with breast cancer in her 50s. And she later died a couple years later of metastatic breast cancer. My younger daughter, Nisha, she faced cancer at the age of 21. She just turned 40, so she's happy to be alive as well. And then the next year, my oldest daughter, she was 25 at the time, she was diagnosed with breast cancer, and she just turned 43. So birthdays are wonderful, and we celebrate them all the time. Despite attending countless doctor's appointments, chemo, radiation sessions, nothing could prepare me for my own diagnosis. On August 1st of 2022, I was diagnosed with non-invasive and pseudocarcinoma, triple negative breast cancer, and I was stage 1 or 2. That day shattered my world. Transitioning from caregiver to cancer patient felt surreal, but I knew I had to fight. Connecting with the team at Mayo Clinic was crucial for an individualized treatment plan, especially since I'm a lupus patient and I had just had a kidney transplant. Collaborating with Unity Point Health Community Cancer Center, I felt ready to tackle this challenge. I began chemotherapy on September 29th, 2022. I remember the social worker there on my first day. I met her. Her name was Mary. She came to my little cubicle. She had a folder filled with tons of resources, including information about a group that we run. I'm co-founder of a group called Splash of Color Breast Cancer Support Group. So I was happy that the information was there. The folder made me feel prepared, but as excitement faded, my depression crept in. Though the entire team at the Cancer Treatment Center was amazing, I needed more than just smiles. I needed more than just happy to see you. I craved constant reassurance and emotional support. Building a strong support system was going to be vital for my fight against cancer. Splash of Color Breast Cancer Support Group and the Can Do Cancer Program, as well as my family, my friends, my pastor, the friends of the community that I work with, all that was provided to me, and it was invaluable support and counseling. It helped me navigate my emotional and spiritual state. Despite having had this unsettling setback, I'm proud to say that I am today a 2-year, 17-day breast cancer survivor. I hope my journey inspires others on their path to recovery. And I need to let all you know that you are not alone. Breast cancer survivors, you're not alone. If I can assist with a survivorship program, I would offer everything that Dr. Deming has said. But what I craved most now, since I'm 2 years out from my treatment, counseling. Counseling is so very important. When I was not able to connect with a psychologist, psychiatrist, or social worker outside of my treatment hours, I can say my mental state was all over the place. It would have been beneficial to have had a mental health professional on staff to assist me in working through my emotions then and for sure now. I think it's imperative to be able to grieve over what was to what will be when we're trying to move forward. You really lose a lot when going through cancer. Having to sort all the emotions that come with that loss with a professional is very beneficial, as I said. I also think that nutrition, physical exercise, mindfulness exercises are needed as well. I lost 10 pounds before my chemo treatment due to my depression. And then I lost 30 pounds while I was going through my treatment. I needed to know afterwards how to get back to a healthy weight, try not to overeat, and to be very intentional about getting to a healthier place. As a survivor, I need to know about and how to plan for daily physical activity and in a way that it wouldn't be painful for me. Mindfulness exercises have been very helpful to me after my treatment. Having these services has been helpful in taking control of my life. Support services and education, survivorship programs that offer support services and education could be the key to assisting survivors in all the changes that cancer has created in our lives. A survivorship program could help us move forward with less obstacles to face, and it could propel us into having a better quality of life. Thank you for allowing me to be a part of this illustrious panel, and be well.
All right. Well, good morning, everyone. It is a great day to be alive. Thank you all for being here today. I want to extend a special thank you to our partners at the University of Iowa College of Public Health and the Iowa Cancer Registry for their ongoing leadership in compiling the 2025 Cancer Report in Iowa. It's an honor to be with you and release this important data for all of us. Each year, this report provides us a clear picture of where we stand in the fight against cancer. And it's more than just numbers. It's a call to action for policymakers, for healthcare providers, for researchers, and for all Iowans to unite in strengthening our efforts towards cancer prevention, screening, as well as treatment and survivorship. And the need for action is urgent. Cancer continues to be one of Iowa's most significant public health challenges. Our state has one of the highest cancer incidence rates in the country, ranking second in the nation. But even as we acknowledge these challenges, we're also making progress. At Iowa HHS, we remain deeply committed to reducing the burden of cancer statewide. Today, I want to highlight 3 areas where we're focusing these efforts. First, we're advancing cancer epidemiology research to better understand the trends and risk factors that contribute to cancer here in Iowa. Second, we're expanding access to all screenings and prevention programs to ensure that more Iowans receive life-saving early detection services. And third, we're enhancing survivorship care to support the growing number of Iowans living beyond a cancer diagnosis, as we found right here today. As you heard in the governor's condition of the state speech, Iowa HHS and the University of Iowa are launching a cancer epidemiology research initiative. This initiative will bring together a dedicated team of epidemiologists to examine the behavioral, genetic, and environmental factors that influence cancer trends across our state. We need to answer these critical questions. Why are certain cancers more common in Iowa? What risk factors contribute more significantly to these trends? And how can we use this data to develop better prevention and treatment strategies for Iowans? By leveraging our statewide cancer data and the University of Iowa's research expertise, we can take a more data-driven approach to cancer prevention and control. While research is critical, we also need to act now on what we already know what works: prevention and early detection. At Iowa HHS, we're working to expand access to cancer screenings and prevention programs through several key initiatives. One of our key kind of screening programs is the breast and cervical cancer early detection program, known as the Care for Yourself program. In the past year, this program has provided screenings for more than 3,600 women. And because of this program, 26 women were diagnosed with breast cancer and 3 were diagnosed with cervical cancer. These are lives that will likely benefit through this early detection and will remain committed to reaching even more across the state. We'll also support the colorectal cancer screening program, which provides free or low-cost screens for Iowans and screened 95 Iowans in the fiscal year 2024. This program is also working to integrate electronic health record alerts and health centers to promote timely screenings. And finally, we continue to invest in tobacco cessation and lung cancer screening. Smoking remains one of the leading risk factors for cancer. And through Quitline Iowa and lung cancer screening referral programs, we are connecting high-risk individuals to the resources they need. Each of these efforts reflects our state's commitment to saving lives through early detection and prevention. I encourage every Iowan to get screened and support efforts to expand access to early detection services. Today, more Iowans than ever are living beyond a cancer diagnosis. And while this is a testament to advancements in early detection and treatment, it also highlights a growing need for expanded survivorship support. At Iowa HHS, we're taking action to expand caregiver wellness programs through our Comprehensive Cancer Control Program. This program's focus on reducing stress, improving health outcomes, and providing financial counseling for families navigating survivorship challenges. Cancer survivorship isn't just about living longer, it's about living well. At Iowa HHS, we're committed to working alongside the University of Iowa, healthcare providers, researchers, policymakers, and other partners to ensure that every Iowan has access to high quality cancer prevention, treatment, and survivorship support. To every Iowan listening today, I urge you to get screened, get informed, as well as take action. If you are a cancer survivor, know that resources are available to help you live your healthiest life. If you're a healthcare provider, let's work together to make meaningful change. I want to express my deepest gratitude to the University of Iowa and the Iowa Cancer Registry for their dedication to research and surveillance, the Iowa Cancer Consortium for its leadership in expanding access to cancer prevention programs, as well as to healthcare providers and public health professionals across our state who are working tirelessly to improve cancer care. And finally, to the cancer survivors here today, your strength and resilience inspire us all. Together through innovation, collaboration, commitment, we can reduce the impact of cancer and improve the lives of all Iowans here today. So thank you.
Thank you all. We'll open it up for questions now from the floor. Questions? Okay.
All of the uncertainty about funding from the federal level, I wonder, and this question for anyone on the panel, I wonder if you could to concerns you might have about cancer research and this effort that's been made to increase the survivorship of cancer. So that
Yeah, I could speak to that. At the University of Iowa Healthcare and the Holden Comprehensive Cancer Center, obviously there's a lot of cancer research ongoing. And as I talked about, there's some programs in survivorship. All of research is sort of under question now of how we're going to fund that going forward. If the cancer funding is cut substantially as has been proposed, then how are we going to do the research? How are we going to provide the resources? There's been a lot of talk about direct and indirect costs. The indirect is providing the resources for the institution for heat, lights, equipment, space, people to oversee the human subjects research that we need to do in a safe way. So a lot of institutions around the country, if you are looking at this, are rescinding offers to graduate students who are the ones who conduct the research because of this uncertainty. So this threatens us now in moving forward with the planned research, but it also threatens our ability to train that next generation of researchers, because those graduate students who would be conducting the research now and over the next few years would be the research leaders who are investing in that career 10 years from now. So I'm very concerned about how this is going to play out. Right now, it's very uncertain. And so it's a matter of how much risk we're going to take in investing the limited resources we're more certain about, and how much we can raise in other ways to fill in the gap.
And I would also point out that I'm a medical director of a comprehensive community cancer center. 85% of patients in the United States are treated at community cancer centers. And we also have a grant from the National Cancer Institute. It's called NCORP, that stands for the NCI's Community Oncology Research Program. So we have over 60 clinical trials that are open at our cancer center for enrolling patients. Just 2 weeks ago, one of them was closed. It happened to be a clinical trial that was looking at special needs of LGBTQ community. And we were just told it's closed. I also happen, like many of us at the table, have many, many different hats. I happen to be the vice president of the Iowa Cancer Consortium. That is our CDC-funded cancer control organization and is responsible for developing the Iowa Cancer Plan. Just 2 weeks ago, one of our workers who'd been with us for about a year and a half received a pink slip because she was still under the probationary period. Her funding was coming from a federal government program. So that's happened already. So we're afraid about what might be happening, but it's already happening. 2 examples of how the change in the administration has already affected cancer services in Iowa.
And I just wanted to add to that as well. I think, we've talked a lot today about cancer data, and I think it will be just as critically important to support the funding for the cancer surveillance programs as well. So the Iowa Cancer Registry is funded by the National Cancer Institute through the Surveillance, Epidemiology, and End Results. A mouthful, we usually just call it SEER program. And I think that as we continue to see what the landscape of funding is going to look like, it's going to be really important to make sure that we are investing in clinical care, research, and surveillance equally.
I guess I just wanted to quick ask a follow-up to that, because you had mentioned, and you answered this a little bit about things that are already happening, but in terms of trials and stuff in the University of Iowa, is everything still ongoing as of now, or has anything actually been paused?
So the question is about ongoing trials and research, and anything has been affected so far?
Yeah.
At the University of Iowa, we've been fortunate to be able to keep things ongoing. And so we've not needed to close any trials. But, again, depending on how these court things play out and whether we can raise philanthropy, other funds to fill the gap, there's a question of what is our graduate school program going to look like next year, and how is that going to affect our ability to conduct research and train the next generation.
Yeah, you bet.
So kind of take more of a state lens, it's currently the Iowa legislative session, and lawmakers have kind of been talking about a lot of proposals related to cancer. In this report, focusing on survivorship, do you have any recommendations that you would suggest policymakers take a look at to kind of help support survivors?
So the question is about policy recommendations to enhance survivorship efforts in the state.
That's powerful. So a couple of things. One is we know many different causes of cancer. Tobacco. So for example, the best public policy way to get fewer smokers is to increase the tax on a pack of cigarettes. There's a bill in front of the House and Senate that would do that. That is the best way to reduce the number of smokers. We're also interested in continuing tobacco cessation programming, and the funding of tobacco control in the state of Iowa has been over different periods of time has been a challenge to keep full funding for that. We're also interested in making sure that we're looking at some of the less well-developed causes of cancer. So we know that there are environmental factors that contribute. In Iowa, we're on a bedrock of radon, not quite the right analogy, but we have a lot of radon. So mitigation for radon. We're also exposed to lots of chemicals all the plastics in the room, but we're also exposed to a lot of agricultural chemicals. We need to continue to do research to see what factor that may have on Iowa's especially high incidence of cancer.
I would add to that, there could be policies that promote survivorship planning. As Dr. Deming said earlier, the medical reimbursement drives a lot of care, and survivorship care is largely not included in that. So I think there are future programs in what's called value-based care, and as long as we as a society value survivorship programming, and care, we should fold that into what a good care plan includes. Now, it can't be overly onerous either, because it can't be something that can't be delivered. And that is one of my concerns with, we all know we want to do more with survivorship care, but if we have 170,000 survivors, can we practically do a 20 bullet point list for each one of them? So I think we have to be very practical about that too, and focus on the things that are most impactful.
Yes.
Are your daughters in genetic testing?
The question I assume is the Cathy about genetic testing.
Sounds like a planning question, but we did not discuss this. Yes, my daughters did do genetic testing. Actually, when they went into their oncologist, my oldest daughter wanted to get tested, and they said she couldn't get tested because there was like a fee or something. So her oncologist fought for her to get tested, and that fee was waived. So yes, Mia Sinead, they did get tested, and of course you should get tested.
I have a question here from one of our online viewers, and this is for Dr. Kruse. What steps, if any, have been taken to start the epidemiology program, and what does that timeline look like?
Yeah, good question. Appreciate that. We're really in the planning phases of this at this point in time. A bill has to pass for that funding source to happen, and once that happens, we can enact kind of the planning around that. I think right now we are working with the University of Iowa College of Public Health on types of data sets that we may be interested in and understanding kind of what those use agreements look like. But we still also need to make sure that any bill for that funding needs to be enacted first before we take place in that.
Question. All right. Well, if there are no other questions, thank you very much, and thanks to our panelists today. We appreciate you.
Thank you. Thank you.
Yeah.
Good meeting you.
And for any members of the media present, if you want to do one-on-one interviews right away, you can just go happen in the room or outside here. Come up and let me know. Thank you very much.
What's your email?
Oh, yeah, already done for.
Thank you, everyone.
Thank you. Thanks. Good seeing you.